Good afternoon, everybody, and welcome. This is our third secondary school children's health and wellbeing dashboard webinar now. It's really great to see so many people joining us today. So welcome back to those who've joined us before, and to those who are new, it's great to have you here this afternoon. And it's really brilliant to see the dashboard is of interest to so many people. We've got 43 people watching so far and a few more still to come, I think. So really, really good. So I'll quickly introduce myself. My name is Zoe Strawbridge and I'm an analyst for Public Health Wales alongside Zach Watkinson, who's presenting here with me today, Matt Jones, Jackie Green and Louise Steens, who are also all on the call as well. And we've actually spent the last few months working on an update for the SHRN dashboard, which has been published today. So as mentioned, we have done webinars before. And they've given an intro into what SHRN is and the background to the dashboard creation. So to avoid duplication, we're just going to be skipping over this part and going straight into what we've actually added this time around in our update. Now, if you're new here and you did want some background info into what the dashboard is and how it came about, we do have a recording of our previous webinar available, and that is on our website. And so you can watch that back at your own leisure. Speaking of recordings, we will be recording this session for anybody unable to make it today, and this will be shared via email, as well as being available on our website as well with the other webinar. So yeah, if anyone's unable to make it today, you can watch that back. And that's it in terms of the admin bit. So just briefly to cover what this webinar is going to be covering today. We're going to do a little bit on the data updates and a summary of what we've found so far. We'll then talk about the innovations and changes we've made in the dashboard that have been pushed by you, the users. We're then going to do a very brief demo of those changes and a brief look to the future as to what we want to actually implement next time we do an update. So we do have space for questions in the chat bar, or potentially in the Q&A section as well at the top of the Teams channel here. So feel free to add your queries throughout the kind of presentation today, and we will try and respond to them throughout. But we will have about 10 minutes at the end of this session to answer questions too. So if you'd prefer to discuss your question, that's also fine. Just wait to the end and we can come to you for that. So joining us for that Q&A session, we have Leanna and Edna from SHRN, and we've also got Lorna from the Welsh Network of Health and Wellbeing Promoting Schools, and they're going to be here to help us answer questions around the survey itself and implementation within schools as well. So moving on to data updates then. So this publication, we've added 30 new variables for the most recent survey, which is the 2023 survey. And just really briefly overviewing what we've added in. I'm not going to list off 30, but we've added in the mental health and wellbeing topic things around problematic social media use and loneliness in the summer holidays. We've added in quite a few variables for the substance use and gambling topic, including data on e-cigarettes and vaping, so just having tried them, use weekly and daily, and also some age first variables, so age first got drunk, age first, that sort of stuff, and also data on gambling. We've added in extra contraception questions, so like emergency contraception use, long-acting reversible contraception, and we've also added in quite a few topics on the school life section, such as being taken seriously and trusting teachers. And then finally, we've also added a new topic grouping called general health, which has got things around feeling low, nervousness, or sleeping issues. So that's just a very brief overview. Do feel free to have a look at the website yourself and have a little play around. And on our kind of landing page website, so the link I sent in the chat, we've added in some summary messages. I think Zach's just going to show that screen now. So we've got some summary messages here, which are kind of interesting trends that we've spotted in the data. Now, obviously, these summary messages are like really high level. Please do feel free to have a look in the dashboard yourself and kind of get a feel for the data. This is very much us looking at it from a very basic level in terms of the summary messages, the first one we found was around problematic social media use. And so this data has come from a bunch of questions around whether students have tried to limit their social media use and been unable to, or whether that's all they can think about, or whether they've kind of neglected other activities to be able to be on social media, or whether it's caused like major conflict within family and friends. So it's quite like a well-rounded question, and it's based off of sites such as Snapchat, WhatsApp, Instagram, like a real variety. So the data kind of shows us that 10% of all boys in Wales and 18% of all girls in Wales in 2023 were actually classified as problematic users of social media. So it's quite a high number, really. And we found that girls from lower middle affluence households are actually more likely to be classified as those problematic users than those from a high affluence household. And we also found that over 1 in 5 girls in year 9 and 10 were actually classified as problematic users, which is double that of boys from the same year groups in 2023. So it's quite shocking numbers. We've seen a lot about this topic in the media recently. So it's really good to get data on this and actually see that potentially girls are more impacted by the problematic social media use than boys. So it's really useful to get that data. And linking to this problematic social media use, we've also added in summary messages around emotional health. So we've seen that more than half of girls in Wales reported experiencing feelings of low mood, irritability, nervousness, or trouble getting to sleep, while only about 1/3 of boys reported the same issues. So it's not brilliant news. We don't know the reasoning behind this. This data doesn't give us that level of information, but we do know that emotional health does change quite a bit in adolescence, from what we see around us and what we've lived through ourselves. But you know, it is useful to be able to quantify those differences between genders using this data. On a different topic, we've also included 2023 data for e-cigarettes and vaping, and I use that phrase interchangeably because the question that was asked in the survey also used it interchangeably. There's a bit more detail about that in the dashboard itself, but we saw there was a rise in students who had tried vaping. So 26% of all students had tried vaping in 2023, up from 20% in 2021. And we've actually spotted that over half of year 11 girls had tried vaping in 2023, which is nearly double the national average in Wales for that year. And of those year 11 girls, they report the highest weekly and daily use compared to all other year groups and genders. So they are kind of the key group who seem to be vaping the most there. And finally, just very briefly, a really relatively new topic to the public health sphere, we've also included gambling data. And so this has shown that boys are more likely to spend their own money on gambling compared to girls. And boys showed increased gambling behaviours with increasing age. And we saw that around 19% of boys gamble at age 16 in 2023. So really interesting data, really wide breadth of kind of information that we've kind of got going on here. And it's super brief, so please do feel free to look into data in your own time. I'm just going to really briefly pop into technical improvements now that we've made before we get to have a bit of a demo from Zach. So in this update, we focused on innovation through you, the users. So we actually gathered a user group a few months ago, and we set up an engagement meeting and allowed the users to tell us exactly what they wanted in this dashboard and what their needs were. So from this feedback, we're actually able to drive change in the dashboard, and the change will hopefully result in an improved dashboard experience for everybody. But very briefly, we've kind of tried to make clearer charts, better image downloads for you to use in your kind of presentations. We tried to make the survey questions really bold and clear, and we've tried to remove anything that's kind of unnecessary in the dashboard. So trying to make it as smooth sailing as possible for everyone to use. Now, we have had a lot of feedback from users, which is brilliant, on the dashboard. So we've only really been able to incorporate a selection of improvements suggested in the limited time that we had. But looking to the future, we're hoping to add other improvements that have been suggested that haven't been met in this update yet. But obviously, Zach will kind of cover that in a little bit. So without further ado, I'm going to hand over to Zach now to show you exactly what we've been up to. And yeah, I'll leave it there. Thank you.
Thanks, Zoe. So yeah, I'm just going to do a quick demo and I'm kind of going to like involve some of the key messages that Zoe said earlier. So first of all, you can kind of see at the top, we removed the geography tab after user feedback that no one was really using it. And we've also kind of made the tabs here for topics and variables slightly clearer, so it's a bit more obvious which ones you're selecting and hovering over. And so having a look at that as well, we also did boy and girl. We changed gender from male and female to boy and girl. And this is to kind of align more to what the SHRN local authority reports used to give you back when they produced those. So first of all, we're going to have a look at the first key message, and that's problematic social media use. So we're going to have a look at girls from lower middle affluence households being more likely to be problematic users than those from higher affluence households. So to do that, I'm just going to navigate to mental health and well-being here, and then click on problematic social media use. And here's our like initial chart, and this is at a Wales level. We want to look at girls as well. So we're going to go and select gender girl, select breakdown, and go on to family affluence scale. And there you go. You can see the chart showing you what you need to know. So the difference between the low and high. As you can see, we've added labels on to make it a lot clearer. So hopefully it's easier to use for you guys. And we've also made the chart area a lot smaller. We've brought up the axes so as you can see it all here. And the download button's a lot clearer now, which is also changed. So if you download your chart, it takes a screenshot of this section here. And if I show you it now, it's a lot easier for you to use this on like PowerPoint, and it keeps in your any caveats you might potentially need and stuff like that. As we mentioned earlier, we've bolded out the questions, so you can see here in the technical info, the question is all bold, so it's a lot clearer for you. And again, if you want to like further investigate this, you can look at the difference between boys and girls. You can click on like the gender here and go to boy and girl, and you can see it has both. So that one of the next key issues that was highlighted by Zoe was like e-cigarettes and vaping, and there was a rise in students who tried vaping from 2021 to 2023, up from 20% to 26%. So if we were to look at this, we'd go on to substance use and gambling, and then we'd want to go on to tried e-cigarettes. So there's two ways we could look at this. There's the compare chart, which is like a bar chart, which will show just 2021 to 2023. And there's also the trend chart, which shows each year of data, so 2017 up to 2023. So onto here, as you can see, it's kind of hard to see the change here. So what we've added after speaking to your users is click to shorten the axes. So if I click that, it can kind of zoom in and give you a much better view of the actual differences. However, you've got to be slightly cautious with this because it can make smaller differences look bigger. And you can also now download this image, and it'll take, again, an exact screenshot of that. So you can actually have a slightly zoomed in one, which might help in PowerPoint or like presentations online. Again, it'll have any caveats you need below. You could also like further look at this. So say you wanted to look at your health board, you could click onto health board on the side. And for example, I'm in Cardiff and Vale. So if I click Cardiff and Vale, you can see Cardiff's there and Wales is there. And you can again shorten that to have a better comparison between your health board and Wales. And you can also add confidence intervals. Again, here the question's bold, and as you can see there, which we mentioned earlier, is about the rephrasing of a question. And you can see there's both questions are there, bold and quite obvious, so you can see what they are and the differences between them. So that's it for the demo, and I'll go back to slides. So just going to talk about what's coming up in the next iteration. So we're looking to add data updates, so it's an ethnicity breakdown. So this will be added into the dashboard, and hopefully most variables will have this. Just on the side, so you click that and it will take you to a bar chart of that. Just for 2023 data, we think so far. And then we've got year group and local authority. So we heard a lot from users that they actually want to be able to look at year group data, not just at a Wales level, but actually at the local authority level to see differences better. So we're going to try our best to add this into as many variables as possible, but it's going to require a bit more further scoping over this next phase, and we see what we can bring in. So this dashboard improvements, we're always looking to improve the dashboard, and this could be both for user experience and for our technical side. So if you ever have any sort of ideas, things you can think of improvements, or spot anything that technically that's a bit strange, just honestly send us an email through our observatory email, and we'll try to get back to you and hopefully implement anything we possibly can. And yeah, finally, you might have heard about SHRN completing the primary survey recently. So we're hoping to bring out a dashboard, and we're hoping that once we've got the data, we'll be able to produce this hopefully by the end of the year, like depending on the availability and the capacity of the team. So yeah, thank you for listening, everyone.